The most critical part of the cancer planning treatment is the diagnosis. So we have to know that how the cancer spreading, how the cancer biology, and how the patient status, so we can plan accordingly. Right now, for the past 10 years, we have learned a lot that each individual cancer is different. Even the cancer are the same type, but because of the nature of the disease and the protein that they express in each individual is different. For example, for the lung cancer, if they have the EGFR mutation, which is a certain protein mutation, they will respond to the certain targeted therapy. If the patient who did not have that certain mutation, they should not respond to the targeted therapy. The cancer treatment will be the most effective way if we can have a comprehensive look by the good diagnosis by looking at the patient's symptoms, how the patient organ function, and take a look at the body imaging, including the CT, MRI, PET scan, and finally, we'll take a look at the cancer cell type, which we can doing the protein analysis. So we can do as a gene panel or each gene and each protein separately. So for the gene panel, we can testing like more than 300 protein and gene combined. There are several companies that can testing for that. We call next generation sequencing. So there are several companies including like Calis Life Science, MI Profile, that's for example. Nowadays, we decide the treatment according to the patient performance status, according to the patient organ function, and also the most important is how the cancer cell biology. So this personalized medicine will lead to the right diagnosis and the right treatment planning, so we can have the most effective way for the cancer treatment and the most effective the cancer treatment outcome. Some patient is afraid to know that they have a cancer, even they have some symptom or they know that there are some unusual things going on. I would say that if you know early, the early cancer is an easy treatment. If you have the stage 0, 1, 2, 3, there are a very high chance that you are getting killed or free of the disease lifelong. Even nowadays, stage 4 cancer, we have the good medication, the good surgical technique, the good radiation technique, so we can control the cancer in some patients. Even some patients, stage 4, we're able to control the disease to the point that they can stop all the treatment and just follow up and use their normal life. There are a few, but I believe that there will be getting more and more because we have the personalized medicine, so we can find the most effective way to treat the cancer in the right way, in the right person, in the right time.